Good afternoon, everybody, and welcome to today's Multicultural Media Online Conference. My name is Lisa Woodland, and I'm the Director of the New South Wales Multicultural Health Communication Service. And I'll be your host today, filling in for the fabulous Jess Halaratne, who's having a well-deserved holiday today. I would like to start by acknowledging the traditional custodians of the various lands from which we're all joining this session today. We're joining you from the lands of the Camaragal people, and I would like to pay my respects to elders past, present and emerging, and extend that respect to Aboriginal colleagues who are joining us today and community leaders from our diverse multicultural communities across New South Wales. At the session today, we'll be talking about childhood vaccination. This is such an important topic, as vaccination is one of our most effective preventative health approaches to keeping children safe and healthy and giving them a great start in life. For this discussion, we're joined by two special guests, Professor Nick Wood, who is the Senior Staff Specialist at the National Centre for Immunisation, Research and Surveillance. We're also joined by Dr. Shanthini, Seelan, a GP and a familiar face to many of us, who's recently joined us for a discussion in Multicultural Health Week about the importance of physical activity and celebrating culture through movement. So welcome back today.
Thank you, Lisa. Good to be here. Thank you.
Well, thank you both for joining us. I wanted to note that today's session will be recorded and will be made available afterwards, so that you might like to share this session with your colleagues and through your networks. As always, we'll be posting some really valuable resources. And again, we would encourage you to share these with colleagues and colleagues and networks. If you have any comments or questions, I'd really welcome you to put them into the chat today. A gentle reminder to everybody to just turn their microphones off during the session. I'd also like to encourage you to add your name to the chat, your organisation, and where you're joining from today. So we'll now start with some questions for our guests. So again, welcome to Shanthini. And Shanthini, can you tell us, we know that childhood vaccination protects children against serious disease. Why is it so important to have vaccinations on time?
Okay, right. Vaccinations are important at all stages of life because it helps to develop immunity. And we know as children, because of their age, their immune system is not that robust as adults. And we are very, very fortunate to have vaccine preventable diseases. It's a big thing, medical breakthrough, that we can actually prevent diseases, and certain diseases that are about now, like for example, whooping cough and influenza, can be quite deadly, especially to young babies and infants. So that is why we've got this very strictly adhered schedule where we start vaccinating children from 6 weeks onwards. That's the earliest that we can. And a lot of hard work has gone behind this, the production of the vaccines, how these vaccines are made. And sometimes what happens is 3-4 vaccines are put together in order to reduce the trauma and distress given to these children. So, and they are set up in a very compact schedule in order to bring about the best effect in the child. So on-time vaccinations is really important. And also the time between each vaccination is also extremely important because it will actually promote the immune status of that child. So at the end of it, by the age of 4, where we complete the children's vaccination schedule, this child will be fully immunized against all those diseases that years ago would have fought a great deal of harm to them. So that's why vaccinations on time. And sometimes when the parents can't bring these children on at that particular date, it's okay. as long as you bring them and we can actually vaccinate them, then they're good. So, the most important thing I have to say now is there are vaccine preventable diseases and we have vaccines to prevent them. So might as well make use of it.
Yeah. Thank you so much. I think it's really valuable for you to highlight for us why those on time, when possible, vaccinations are useful for our children because of the effectiveness and keeping them safe and keeping them healthy. So thank you. I'd like to now ask a question of Professor Nick Wood. Nick, thanks so much for joining us online today. There's been a lot of discussions around vaccines and their effects. Can you please tell us how vaccines are approved and how they're tested for safety?
Yeah, hi everyone. So yes, the vaccines, before they get rolled out into our community, go through a very strong and robust testing process. So vaccines have to go through clinical trials, and there's a whole range of clinical trials that are done. And in those clinical trials, they're looking at the safety of the vaccine, but also how well that vaccine works. And then what happens is once the company feels that the vaccine is working well and is safe, then they apply to the regulator, which is in Australia is called the Therapeutic Goods Administration, the TGA. And the TGA will then look at a full file, so looks at all of the information about that vaccine, its safety and how well it works, and then decides whether or not it can be approved for use. Once that vaccine is approved for use, then it can roll out into the community. And as many people will have heard about, there is the group called ATAGI, and ATAGI decides which members in our community will benefit best from the vaccines, and they will make recommendations about who to use it in. But once the vaccine is rolled out into the community, the monitoring of the safety doesn't stop. So we have two very strong ways to monitor safety. We have two reporting systems. One is where doctors or patients who feel that they may have had an adverse event, so that is a reaction, they can report it to the TGA. And the TGA gets reports from around the country from different people. And they look at that almost on a weekly basis to see if there are any issues with the vaccine once it's being used in the community. And we also have another program which is called AusVac Safety, and that many people may have actually taken part in this, where you get a vaccine and then you're asked to fill out a survey, and that survey is looking for side effects to the vaccine. So we have two very strong ways to continually monitor the vaccine once they're being used in the community. We do know that vaccines can cause some side effects, and these are usually mild and short-lasting, like pain or swelling or redness at the site where the vaccine is given in your arm. Sometimes people can get a mild fever or feel a bit tired, but the serious side effects are very rare, and in general, the benefits of vaccination far outweigh any risks.
Thanks so much, Nick. And look, that's so reassuring for us all to know about those safeguards that are in place around vaccines. Nick, another question for you. How can parents and guardians make sure they're up to date with their children's vaccinations?
Yeah, so there's a couple of ways. One is that you may have kept a copy of your Blue Book, which is we use in New South Wales as My Personal Health Record, also called the Blue Book. You get given that when your baby is born. And that has lots of information in it about the vaccines that your baby is due to get and the time that they get it. It also has lots of other useful information about your child's health and development. And so you can record the information there. So that's one important way to look at your Blue Book. The other way is to look on the New South Wales immunisation schedule. And I think I saw a link was put into the chat. And that there it is there. And so that is a good way to look at what the schedule is, and then let's see whether your baby is on time for those vaccines. As Shanthini said, the on-time vaccination is quite important because we choose these particular ages to give the vaccines not because we think they're the simple ages, but because we think they're the best ages to give the vaccine. So that's the two ways, and then the third way is you can ask your GP to look up on the immunisation register as well.
Thanks so much, Nick. Shanthini, back to you for another question. Where can parents take their children to be vaccinated?
Okay, your friendly neighborhood GP. As general practitioners, our main aim is prevention, and so one of the ways we prevent is to provide vaccinations. So you could take them, and usually what we have here is when newborn babies usually come to see us within the first week of birth. So when we check them out and ask the parents about how things are going, we always remind them. So we are going to put in a reminder for your child at 6 weeks. You're going to come in, you're going to get a text message saying that your child is due for vaccinations. And then that's how usually most of my colleagues will do that. So the parents actually have a fail-safe method. They have a text coming in, and we've already warned them, make sure you wait for this. And of course, in the Blue Book, interesting with the Blue Book, I just digress a little bit. Years ago, we had a Blue Book. At the back of the Blue Book, we had all the vaccines were all stated. It was printed there, and all we had to do was when we gave the vaccine, just put the date. And then throughout the years, there have been so many changes, vaccines, so many new vaccines have come, so many different combinations. Now it's just a blank space. So because I think there's lots more work going on, which is really fantastic. So all we now do is we write down the vaccine. So that's what I have to say, because over the last 20 years, things have moved so much, and more new vaccines have come into play, and things have got really good in the Department of Prevention. So childhood vaccination has really been a work in progress, and it's come from a long way. So we really have to make use of what we have right now. So other than GPs, you could go to your Aboriginal medical services. Some community centers do it as well, and some local councils as well. So it's freely available. There's no reason why anyone should lose out.
Great. That's great to know. Thank you. Nick, I know that for many parents, many new parents in particular, sometimes they're a little concerned if their child is sort of unwell or a little bit sick or has a little bit of a fever as it comes time for vaccination. Is it safe to vaccinate children when they are sick?
Yeah, so look, the general rule is if your child has a minor illness, so if they're not too sick, they have a little bit of a runny nose, but they're otherwise eating and drinking okay, and no rash or anything like that. And certainly if they don't have a high fever, so high fever means a fever above 38.5, then it's okay to have a vaccine, and they can have that safely. So if they've just got a bit of a runny nose, because as we all know, children can spend time in daycare, early childhood centre, daycare sort of environment, and they can actually get sick from being in a daycare environment, and particularly during winter. So if your kid's got a little bit of a mild illness, but they're not too bad, they're running around, eating and drinking normally, then it's okay to give a vaccine. If, however, they're not quite their normal self and they've got a high-ish fever, then best to wait, not give them the vaccine, best to wait till they've recovered. And that's not because the vaccine won't work, it's just that we know that some vaccines can cause a fever. So if your child has a fever from, say, a virus, and they can possibly get a fever from a vaccine, then they've got another reason to get two reasons to get a fever. So we prefer to wait until the kids are pretty much back to normal. If you've got any questions about that, so you can always talk to your doctor or health clinic staff, and they can say, look, yeah, let's just wait. We won't give it today, but in a week's time, when they're back to normal, we can give them the vaccines.
Thank you, Nick. And again, that's just really reassuring, I think, for parents that, if it's only a mild illness, then it is safe to go ahead. But to check with your GP if you're a little bit unsure. Shanthini, what would your advice to new parents be?
Okay. Vaccinate. So that's important. And I find that new parents are very cluey, and they want the best for their child. So most of the time they will do what we ask them to do. And of course, when we do these things, we often give them a little sheet detailing all the side effects to be expected, and often say that, and also timing the vaccination, what time of the day we would prefer them to come in the morning. So if anything untoward should happen, there's always help around for them. So, and also with the babies, it's interesting to note that newborn babies, though the time when they get pricked, they might be a bit uncomfortable and cry. After that, there's something, the vaccine, that puts them to sleep. I've noticed that, and they completely forget all about it. It's just the parents who are more traumatized. But it's just that it is a very important step in their child's health, and it's important that they do this for them.
Thank you. Look, I know for myself, with my first child, I was very anxious. Second child, felt very comfortable. So I think that's lovely advice.
And at times they get 3 needles. And there was a time when we had to vaccinate each limb, 4 needles. It was traumatic for us, but I can imagine.
All in a good cause.
All in a good cause.
Yeah. What I'd like to do now, Nick, is just go back in time from new parents and focus on vaccinations during or before pregnancy. Can you tell us what your advice for people who are planning to have a baby, and what vaccines might need to be considered before pregnancy?
Yeah, so if you're clever enough to say, I'm going to get pregnant in 4 months' time, and I'm now getting prepared to do that, which is wonderful, then the things that you would want to make sure that you're up to date with is, as the pregnant woman, is measles, mumps, rubella, and chickenpox. Okay, we can't give these vaccines to a woman when she's pregnant. So we need to give them before you get pregnant. So you can go to your GP and say, look, I want to get pregnant. Can you just check my past vaccines, make sure I've had the right doses of measles, mumps, rubella, and chickenpox? And if that's all good, fantastic. If not, you can always get a booster dose of those, and before you get pregnant. So that's that's the ideal before getting pregnant. Once you are pregnant, then there are a range of vaccines that, two mainly, that pregnant women should get, which I can talk about if you'd like.
Okay, thanks, Nick. That's really helpful. So if we wind forward a little bit into that pregnancy period, Shanthini, when you're talking to young parents to be, what vaccines do you recommend for them in pregnancy?
All right. Okay. As like what Nick said, I like to see them before they get pregnant. So we always tell them, please do not fall pregnant. Please plan your pregnancy and do all this work.
A bit of a big ask sometimes.
It's a big ask, but then there's nothing more stressful and anxiety provoking to find that you are not immune against chickenpox, which is so highly contagious, and you are pregnant, and it's disastrous to have it in the 1st or the 3rd trimester. And it's an awful thing to have. So you might as well take the time, plan your pregnancy, get yourself up to date with all your vaccines, get your body in tip-top shape, and then fall pregnant. And then have a peaceful 9 months and have a wonderful time looking forward to your baby. Okay, the other things I would really encourage my patients to have while they are pregnant is actually the influenza vaccine, because we know how disastrous influenza can be on a pregnant woman, because pregnancy does lower your immunity. A lot of women who are pregnant come to me with very frequent colds and coughs because of their immunity is so low. And being pregnant in winter is no fun, because you're going to get everything under the sun. So influenza is really important. Influenza vaccination is really important, and it's given free to all pregnant women. And of course, after the 20th week, we also give the whooping cough vaccine, because in that first 6 weeks where the child is not vaccinated, the highly the child is very vulnerable to getting infections, and whooping cough is making a return and is disastrous, and it's at the high mortality and morbidity rate if the child, a newborn, were to get whooping cough. So we like to vaccinate. These two vaccinations we give. Influenza can be given at any time, and whooping cough we wait after the 20th week to be given to the woman, in hopes that the antibodies that the vaccine creates in the mother will actually go into the baby, and at least for that first 6 weeks of life, there's some protection for the baby. So we are quite pedantic about it. We make sure we put reminders and get the mother back and say, we need to give you these vaccines. So these are the two vaccines. And like Professor Wood says, these vaccines are not live vaccines, so we can actually give it to them, and it's quite safe.
I guess that's also...
I was just going to just add quickly, sorry, the whooping cough vaccine is actually very, very effective for preventing whooping cough in young infants. So I always think of the first dose of the baby is actually the dose that the mother gets during pregnancy. And like Shanthini said, mums are very giving people, and so they will make a good amount of antibody themselves to the vaccine, and then the antibody crosses into the baby. So the baby starts life with some protection against whooping cough, and it's a very, very effective vaccine to stopping the young babies getting whooping cough.
Yes, of course. That's another thing we call cocooning, where we actually vaccinate everyone who's actually going to be in contact with the baby, so like the father and the grandparents as well. So hopefully this will be enough to support that young baby till 6 weeks when the baby gets his first dose.
Great. Thank you. Nick, noting that pregnancy can also be anxiety, high time for many pregnant women, could you just comment again on the safety of vaccines during pregnancy?
Yeah. So like Shanthini said, these are vaccines, what we call killed or inactivated vaccines. So they're not live. So what we're effectively doing is giving you a part of that bacteria that cannot cause disease at all, and your body recognizes that as foreign and makes the antibody to it, and then that antibody protects you. So vaccines for pregnant women, particularly flu and pertussis, have been used across the world for more than a decade now. So we have a very, very sound and good knowledge of the safety of both of those vaccines in pregnant women. And there are no safety concerns. They don't cause premature delivery. They don't cause babies to be born with low birth weight. They really just very, very safe. And it's the best thing that you can do to protect your young infant once they arrive out on the planet, to stop getting flu or whooping cough. So we have, as I said, we've been using them around the world for more than a decade, and the tetanus vaccine, which is actually contained in the whooping cough vaccine, has been shown to be very, very effective in many countries to stop newborn tetanus. And so, hundreds of thousands, millions of doses are being given to pregnant women across the world, and we know that it's a safe vaccine. There is a website called Sharing Knowledge About Immunisation, or the SKY website, and that has a very nice little diagrams on it that you can go on to. Click on the links, particularly there's one for pregnant women and for just mothers and parents of children, and that gives you a whole lot of information to help you make a decision.
Great, thank you, Nick. And look, we'll try to add a link to that resource in the chat. Otherwise, we'll send that out when we email everybody afterwards with the recording. Shanthini, I feel like you might have wanted to add something in there. Was there anything else that you wanted to comment on?
No, not really. I think Professor Wood has said it.
Yeah, wonderful. And look, just again, a reminder, where should pregnant women or women planning to get pregnant, where should they go for vaccination?
To their GPs, of course, naturally to their. And can I just put a plug for a little bit what this is my passionate area.
Yes.
Is women who want to fall pregnant. Not only should they get their vaccinations up to date, but get their overall general health up to date, because pregnancy is a highly, very stressful period. It will bring out diseases that that are hiding under, and it'll bring out. So like, for example, what's on the rise now is gestational diabetes.
Yeah.
And if you're not tip-top in your health and you do get pregnant, you will end up with this. So my plea out there is for couples who want to fall pregnant, please go and get what we call a preconception counseling appointment and do the right thing and enjoy your pregnancy, enjoy your family.
Wonderful. So this is from the Department of Preventative Health.
Exactly.
Yes. Wonderful. Okay. Look, there's a lot of comments in the chat about some resources and translated resources, and I can see that they're being answered along the way. I think a lot of the comments are in relation to the number of languages that resources are available in, and that's something I know that is really important to New South Wales Health. It's something that's important to all of us. So we'll make sure that we provide you with as many links to translated resources as possible, and take that message back as well, that really we need these resources in all languages for all families. That's very key. If there's any other sort of questions, you're welcome to add them into the chat. We've got a few minutes left. And Nick, I can see that you've added in that resource for everybody. So, encourage people to go through and have a look at the resources to really inform themselves, really spread the word around your networks, your colleagues, your families, about how very important it is in relation to childhood vaccination. And, Shanthini, I loved what you said. It's about cocooning, isn't it, really? It's about protecting our babies and our children. And that's a whole family effort in lots of ways, to encourage the vaccination, to take the vaccinations that we need as parents or grandparents or people who are very close to young children as well. So I think that's a really important message for everybody in the community.
We usually do.
And just to add that right now, we unfortunately, because of the COVID pandemic, we have seen a little backslide, so a little reduction in some of the vaccine uptake, and that we don't want that to continue, because unfortunately, what we're seeing here has also been seen in other countries because of COVID. And what that has meant is that there's been a rise in cases of measles, and that's sort of, and then the risk there is that now that people are starting to travel again, these viruses can be coming back into the country. And if you're not up to date or on time with your vaccines, that means you're not protected, and therefore you're at risk of getting these infections. So it's probably right now a little bit more important, although we want everyone to be on time. This period right now, as we're coming out of COVID, it really is important that we don't lose the coverage, the vaccine uptake doesn't fall.
Thanks very much, Nick. So I might go to each of you just for a final comment before we wrap up this afternoon. Nick, is there anything that you'd like to say as a sort of a lasting key message for everybody online?
Yeah, look, I think the vaccines that we're using have been, particularly the ones on the schedule now, have been around for more than a decade, and they're very well studied, and we understand how they perform in terms of their efficacy, their effectiveness, and also their safety. And if there were issues, they would be picked up by our safety system monitoring them. So we know that the flu vaccine changes each year, but each year we really hone down and we look closely at the safety to make sure that, because the flu vaccine has changed from last year, that there's no change in the safety of it. So people can be reassured that the vaccines, we know how they work, we know that they're safe, we know they're effective, and it's the best thing that you can do to protect your young baby and child from getting these infections.
Thank you so much, Nick. Shanthini, last words from you as a passionate GP that was working.
I thought Professor Wood's words, and also the vaccines, how we deal with vaccines in our practice, in most practices, is it's done in a very highly systematic way. We've got a cold chain, we've got a specific vaccine fridge, and we are all trained how to give, how to monitor the vaccines. So it's a big thing in general practice, and of course in all the other places where we do give the vaccine. So it is it's an extremely important part of your child's life. It is there for you. Please make use of it, and yeah, please look after your children.
Thank you so much. Look, that brings us to the close of today's Multicultural Media Online Conference. And I'd like to very sincerely thank our wonderful guests for sharing their expertise with us today, Professor Nick Wood and Dr. Shanthini Seelan. Thank you to all of you who have joined us today. It's really great to have you online with us. A recording of this session will be made available. We'll email out the link, and also on the Multicultural Health Communications website. I hope that you're able to share all the valuable information from today's session with others, and to really highlight the important role that we all have in supporting parents, families, and communities around childhood vaccination. Thank you very much for joining, and goodbye.